I'm so pleased this morning to introduce our guest speaker to you, Melissa Mazzeo. We invited Melissa to speak as part of our racial justice ministry here at Emmanuel, as she deals with healthcare disparities in her work with Partners in Health in New Bedford. Partners in Health is a nonprofit that was founded on the principles of liberation theology, which means that there should be a preferential option for the poor. In other words, God beckons us to focus on and side with those who suffer from poverty and oppression in their struggles for justice. Melissa is a senior project lead at Partners in Health's U.S. Health Accompaniment Unit. She also has vast experience in various settings around the world, where she's always worked with a focus on not just serving, but also fighting for justice in healthcare. She will share with us exactly how she does that in her work. And then Melissa will stay on for coffee hour to answer any questions you might have and speak a little bit more, so that we hope, if you're able, that you'll stay on for that conversation. So again, welcome, Melissa. We're so pleased and grateful to have you with us this morning.
Thank you so much, Holly, for having me and for that wonderful introduction. And thanks to everybody for allowing me to speak today. I also wanted to just briefly introduce Hamilton Ho, who is my colleague at Partners in Health and is also joining this call. So thank you for being here. And thank you all again. I'm really, really happy to be spending this morning with you. So I'm going to share just a few slides. I didn't want it to be too much of a presentation, but I do have a couple of slides to illustrate. So let me share my screen. Okay. And can I get a thumbs up to make sure people can see that? Great, thank you. Okay, so thank you again for having me, and thank you, Holly, for introducing me. Like Holly said, my name is Melissa Mazzeo, and I work with Partners in Health. I'm currently working on the COVID response in New Bedford, right here in Massachusetts. So I wanted to start just by giving a little bit of context of the public health system here in Massachusetts. So as you all probably know, it's a very advanced healthcare system compared to much of the country. You know, it's something to be proud of. I'm born and raised in Massachusetts myself. It's something that I was always taught, you know, as something that we should be very proud of. But when you look a little bit more closely, there are significant inequities within our state in terms of the healthcare system. So I could share a number of statistics with you, but wanted to touch on just two specific ones. So first is regarding life expectancy. The average life expectancy in Massachusetts is high. It's 80.7, which makes us sixth highest in the entire country. It's a full 2 years longer than the national life expectancy, but within the state, it varies widely. So if you are in a wealthy white neighborhood in Newton, for instance, your life expectancy is 94.2 years. But then if you're in a poor neighborhood in New Bedford, it's 68.1 years. So that is a full 26 years difference just between those two environments. And the two cities are just a mile's drive or an hour's drive away from each other. It's like 60 miles. So just let that sink in for a little bit. And then the second statistic that I'd like to highlight is very topical. It's something that probably everybody here has heard about, but it's worth just drawing attention to, and that's the racial and ethnic inequities related to the COVID pandemic here in Massachusetts. So in terms of infections, if you are Hispanic, you are 4.3 times as likely to have gotten infected with COVID compared to a white person. And if you are Black, you're 2.7 times as likely to be infected in Massachusetts. Similarly, with hospitalizations, if you're Hispanic, you're 1.7 times more likely than a white person to be hospitalized. If you're Black, you're 2.3 times more likely. And there's similar statistics for deaths as well. So these are just kind of two indicators that show, despite the fact that our Commonwealth is, you know, doing a lot right with healthcare, there's still so much more work to do, and so much that we can't be proud of. So wanted to kind of set that that picture, and give kind of a very top level attempt to explain some of the reasons behind these disparities. Within public health, it's something that we refer to as the social determinants of health. And that's really just the factors in a person's life that affect their health, things like education, employment, income, neighborhood safety, environmental health, access to healthy food. And in Massachusetts and around the country, historically, non-white people have worse social determinants of health. And that's directly a result of generations of structural systemic racism. So policies and systems that had been put in place with kind of racist underpinnings that systemically deprioritized and underfunded and under-resources communities of color, thereby leading to these poor social determinants of health. You know, people of color in Massachusetts have lower education, have less secure employment, have lower income as a whole, less safe neighborhoods, worse environmental health, less access to healthy food, and I could go on. And again, this is not due to their own, anything about their own nature as human beings, but rather kind of these external systems that have been placed upon them in a very oppressive way. And so even though, even if this seems to be something that we've moved beyond as a society, it really is embedded into the structures and the systems that still exist. And that's kind of the definition of structural racism, is like you need to go in and proactively change those structures because they continue to affect people to this day. So as a result of these social determinants of health, you find that people of color have significantly worse health outcomes compared to white people, again, in Massachusetts and in the country. And that applies to kind of all aspects of health, whether it be life expectancy, cardiovascular health, asthma, obesity, I could go on. And again, when an acute health crisis like COVID comes along, then same thing, it's much worse for communities of color than for white people. So these social determinants of health are something that PIH has been working to address around the world since we started. So I'll share just a little bit more about kind of the background of PIH. Holly did give a really great overview, but just to share a little bit more, we are a global health and social justice organization. Our mission is to promote healthcare as a human right. We've been doing that since 1987. And the way that we do that is to strengthen existing health systems by partnering with public health entities. So instead of going into a place and setting up kind of a separate parallel system of healthcare delivery, we really work directly with the existing public healthcare system to strengthen that and to address both direct health outcomes as well as these social determinants of health. We began our work in Haiti, and I'll leave it on the slide for now, but we began our work in Haiti, and I know Holly has a strong connection there. But one of our co-founders, Dr. Paul Farmer, traveled to Haiti when he was a medical student. He saw the disparities faced by people there firsthand. The region that he traveled to is called the Central Plateau, and the people living there were rural people. They had been displaced from their homes by this large dam that had been built. So their previous homes were underwater and they were totally displaced. So the people that he was encountering were kind of neglected within this already poor country. So from the beginning, our work has addressed kind of the people who have been the most neglected wherever they are. So these people in Haiti in the Central Plateau, they were suffering from ailments that were preventable, treatable, and they also had, again, very negative social determinants of health. They were facing poverty, hunger, lack of education, lack of opportunity. So that's kind of setting the groundwork for the need. Since starting our work in Haiti and again, working with the public health system, developing health interventions, both around physical health, but broader social determinants of health. We've expanded our work now to 11 countries around the world, as well as now in the US, we're working on the COVID response here, supporting 16 different jurisdictions around the country. So I want to speak now just about kind of some of the core principles that underlie the work that PIH does. So the first is something that we call accompaniment. Everywhere we work, every one of these countries and every one of these jurisdictions, we've been explicitly invited to be there. So we will not go into a place unless we've been asked to do so. And once we do, again, we partner directly with the public health system in most of the countries we support. That's the local Ministry of Health. In New Bedford, it's the city health department, and so on. In the US, it's whatever local health system has invited us. And we also partner with existing on-the-ground organizations. We really try to help those existing entities move forward their goals rather than coming in and trying to implement what we think is needed. We strongly believe that they know best what they need help with, and it's not up to us to kind of determine that. So this accompaniment mindset, is a way for us to essentially decolonize the practice of global health and international development, which have had historically a very colonialist, imperialist, kind of paternalistic approach. And we are very much against that approach. We really try to move away from what we call the white savior industrial complex. That's not the way we do our work. And this accompaniment model extends also to patients directly. So we take a very patient-centric approach. Again, we're not only helping with their physical health needs, but the social needs, food, shelter, employment, mental health. We know that we can't truly help with people's health issues unless we deal with all of these other issues that encompass the whole person. This definitely makes our work much more complicated, but we believe it makes it more effective and longer lasting. Kind of the second core principle that, again, Holly referred to, but I also want to speak about, is this concept of liberation theology that influenced our mission and our theory of change from the beginning, although we are a secular organization. And this is a school of thought that centers poor and neglected and oppressed people. So it's not enough to say, we're going to treat all people as equals, we're going to treat everyone the same, because of generations worth of neglect and oppression. You really need to proactively lift people up and provide this preferential option for the poor. I almost think of it as like an affirmative action sort of system to, make up for all of that neglect that's happened. And again, this is not something that can just happen on its own. It's something that we need to be extremely proactive about and infuse into the work that we do. And, within PIH, it's almost become this like shorthand concept of this preferential option for the poor. We've shortened it to O for the P, option for the poor. And it does infuse kind of every decision we make in terms of our programming and our strategy, in the back of our minds. Is this O for the P? Is this new move going to be an O for the P process? So that's been really important to us kind of throughout. And that does apply to the work that I'm currently supporting in New Bedford. So again, we were asked directly by the local health department to support their needs. What that ended up looking like in New Bedford was that they've asked PIH essentially to take on a lot of the COVID response work ourselves. So one thing that doesn't get talked about as much, but is really important, is that over the past 14, 15 months that we've been dealing with COVID, other public health needs did not go away. In fact, they significantly worsened in many cases, and especially in places that had a higher burden of COVID and of existing health inequities and poor social determinants of health. So in a place like New Bedford, there's a major substance abuse issue. There's violence, there's housing insecurity, and then there's also just the basic kind of functions of a public health department, like health inspections. All of these were kind of ground to a halt during COVID because the health department itself, historically underfunded, under-resourced, had to divert all of its attention to responding to COVID. So the accompaniment that PIH is now providing to the health department is, let us take on the COVID response and let you as a health department go back to this other work that you haven't been able to prioritize and really address these needs of the community. So within New Bedford, within this COVID response efforts, we're supporting significantly the vaccine rollout and really trying to prioritize vaccine equity, making sure that we're running clinics that are accessible to people, they're happening in locations that reach the people that have not been getting the vaccine in high rates, making sure they're occurring at times that are conducive for people. We're setting up a lot of mobile clinics, so physically going to places where people aren't getting the vaccine as much. We're coordinating closely with local partners on outreach and education, making sure that people get the information they need to make a decision for themselves about the vaccine, because ultimately that is a personal decision to be made. And once people do make that decision, making sure that they get the information they need about how to get it, where to get it, what they need to do. Make sure all of the messaging is accessible in terms of language, it's easy to understand, it's written and disseminated in Portuguese, Spanish, Cape Verdean Creole. These are all the languages that we really need to make sure our messaging in New Bedford is being put out. And also just what we call barrier mitigation. So there's a number of reasons why people who want to get the vaccine, it is a challenge for them. So working closely with communities and with individuals and with partners to understand what those barriers are. Is it, the need for childcare? Is it transportation? Is it a fear that, you'll get in trouble at work if you leave, or if you take the day off because you don't feel well after the vaccine? And really working closely to mitigate those barriers directly as they arise. And in the long term, I think we entered into New Bedford to support the COVID response, but one other aspect of PIH's work that I think is important to share is we stay. So we don't, there's organizations that come in and provide kind of short-term emergency response, and that's needed and that's necessary, but that's not PIH's approach. So we really believe that this accompaniment model is, only works when we work on the time frame and the needs of who we're supporting and our partners. So you can't do accompaniment on your own timeline. So now that we're in New Bedford, we're there hopefully to stay as long as they want us to, and move beyond the COVID support that we're providing currently to provide kind of larger scale, bigger picture health system strengthening at a strategic level. And part of that is building out the capacity and building out human resources. We are building a team, and again, prioritizing that team be in tune with the community, speak the languages of the community. And so as we build our support, we're really trying to make sure that it's for the long haul. And I want to close with this quote that was said by Dr. Paul Farmer, our co-founder, and I'll read it to you because I think it's worth saying out loud. So he says, "The idea that some lives matter less is the root of all that is wrong with the world." And I think that that's the sort of quote that, if you look at it, you just kind of automatically agree. Of course, that's something I believe. Of course, everyone's life has equal worth. But I think if you really reflect on it and think about it and really look at yourself, you'll realize that it's not that straightforward. I think, it's human nature to abstract other people and to compartmentalize and to kind of separate those who are close to you and those who you know and who look like you and you're familiar with. Those have a higher weight than people out there. And I think it's understandable that is human nature, because otherwise it would be crushing to go through life and hear news of suffering around the world and really appreciate that every single person who suffers has as much depth as anyone else. So I strongly believe that this is something that we need to kind of keep in our mind and recognize that it is our tendency to deprioritize some people compared to others. But we need to do the work internally to really make this statement a reality. And I'll share just kind of a brief anecdote from my own personal experience. So when I was in college, I went to a spiritual retreat, and one exercise that they had us do was sitting in a circle. So there's like two concentric circles of people, and you're sitting on the floor cross-legged, and you are facing one other person. And the entire exercise, you just look into their eyes. And it's silent, and you're just sitting there and you're just looking at each other. And it's for an uncomfortably long period of time. But after, the initial awkwardness wears off a little bit, it's one of the most powerful experiences I've ever had, just looking into a stranger's eyes and seeing them. And I think in those moments, I was able to kind of understand the meaning behind this quote, that this person sitting across from me has just as much depth as I do. They're just as multifaceted as I am. They have goals in life. They have things that they're excited about. They have things that they're ashamed of. They have people who they love. They have people who love them. They're just as much of a person, a whole person, as I am. And I think we need to, again, constantly remember that every single life is as whole as our own. Every single person in Haiti, every single person in Palestine, every single person in New Bedford, every single person in Wakefield. So this is something that I try to take with me every day in the way that I just approach my life, the way that I approach my work through PIH. And again, I think this is something that PIH does try to imbue into its work, everything that it does. So I invite you to take it with you too in the week ahead and hopefully longer. So thank you again for taking the time to allow me to share. And I'm happy to answer any questions. Thank you.
Thank you so much, Melissa. That was wonderful. And again, we hope that people will stay on and hear more.